Start to arrive. My name is Erica Cochrane, and I work for the International Crane Foundation, which is a mid-sized conservation organization based in the US, but we work around the world protecting cranes and the ecosystems on which they and other species and human communities depend for the benefit of those species as well as for those human communities. I am here with two other people. If you would wave your hands, Claire Relton and Megan Murison. And the three of us facilitated this learning initiative focused around population health and environment approaches. We stepped up to facilitate this learning initiative, not because we're experts in the field, but because both of our organizations are at the start of launching population health and environment approaches across our work in Africa. And we wanted to help our organizations learn more about the approach. So the other thing that I wanted to mention is that there are a number of people who are on this call that were part of the learning initiative. And those of you who were part of the learning initiative, if you turn on your videos and wave before we go into like sharing screens and you can't see everybody. So there is a number of us, thank you. And then before we launch into an actual presentation where I'm sharing screens and stuff like that, we want to hear from all of you why you logged in. So Sarah is going to launch a poll just now. You should see that poll come up on your screen, hopefully soon. And go ahead, there's two questions, one about why you joined and the other one about your knowledge of PHE, or population health and environment approaches. And while we're waiting for you to respond, Sarah is in the background and she is helping to manage the chat and looking at your questions and comments throughout the webinar so that we can try to address those at the end during a question and answer session. So we are getting close. I think that's probably good enough to share right now. So if we share those results, so many of you logged on to learn more about PHE and its value, to also see the results of the learning initiative. And most of you have at least some knowledge of PHE. So we'll check back in at the end of the webinar to see whether the webinar was helpful. And I will go ahead and share my screen just now. So as I mentioned, this is part of a summary from a learning initiative around population health and environment approaches. And this was part of a learning initiative series that was launched in 2019 and is supported by the Conservation Measures Partnership, or CMP, as I might refer to them, and the Gordon and Betty Moore Foundation. It fosters collaborative learning across the conservation sector to increase our knowledge, address knowledge gaps, and hopefully to improve our collective effectiveness. In 2020, the conservation sector, you all, helped to prioritize 4 different learning topics that, if you look at them, all 4 of them are related to the people side of conservation. So a clear interest in learning and doing a better job of addressing the people side of conservation. And in particular, the population health and environment approach that we help to this learning initiative is closely related to the justice, equity, diversity, and inclusion learning topic, as well as the holistic approaches learning topic, where in its ideal form, population health and environment is one type of holistic approach that follows JEDI principles, but includes a reproductive health component. And we'll get to that more when we get to our definition and theories of change. So the purpose for our learning initiative was really to provide clarity and to address barriers to adoption where it might be appropriate and beneficial, and to make some recommendations for future action. There are 2 main products that were part of this learning initiative. One is a final report, which Sarah will drop into the chat, a link to that report. It will also be in a follow-up email. that is basically an annotated slide deck that is meant for reading, not necessarily for presenting. It's pretty thick. We will not go into all the detail that is there in that report. There is also an entry into the Conservation Action and Measures Library, or CAML, where we have our definition and our theories of change. I'm really going to breeze through our methodology. We basically formed a collaborative learning group that included 29 experts in integrated health and conservation. So the three of us that were facilitating were not the experts, but everybody else was. And you can see that they represented a number of different organizations. We did this in a very concentrated period of time over 4 months, with 3 major workshops or convenings and a lot of work that happened in between by a number of different working groups. In addition to the expertise and the evidence that those experts brought to the table in this learning initiative, we also collected data beyond that from key informant interviews, from an expert survey that went out beyond those involved, from some homework that those involved completed, and out to you all, out to the conservation community through CMP and CCNet, to understand better the conservation sector's knowledge, attitudes, and interests in PHE. Now I really want to jump into presenting some of our main findings or outcomes from the learning. And we identified a number of situations where population health and environment may be an advantageous approach to conservation. And that includes where there is a local dependence on local natural resources that are in short supply, where overuse threatens biodiversity and ecosystem services, as well as human health and human livelihoods. Or in other words, where the health of the biodiversity and the health of humans is inextricably linked. Where poor human health limits the community's ability to engage in potential solutions, and where women are underrepresented in that engagement. Where the community requests health support, and particularly request support for reproductive and maternal health, where there's an unmet need for family planning, and where local human population growth is at least one of the drivers of overuse. And before I hand over to Megan, who's going to present on our definition, I'd like us to have an opportunity throughout this webinar to hear from some of those expert voices. So first, I would like to introduce David Johnson from the Margaret Pike Trust. And David,
thank you.
I will spotlight you for everybody.
Thanks. So I think both the conservation and the health sectors are very data-driven. But one of our challenges is that the health sector hasn't been very good at sharing its relevant data. And I feel it's okay for me to say that running an organisation, training more doctors and nurses on family planning in the UK than anyone else. We've also not been very good at making our data relevant to the conservation sector. It's very common in conservation documents and policy papers for future population size to be stated as a fatalistic fact, that there will be 9.8 billion people, say, in 2050. But we haven't been very good at highlighting that very small changes or relatively small changes in fertility can have dramatic impacts on overall population size. So if you're a conservationist thinking that population is relevant to conservation, it's good news to know that the health sector knows what to do and that the number isn't fixed. We're focusing on barriers to family planning. So those are the geographical, social, educational, financial, or other obstacles that prevent women and girls from accessing the health services that they would like to access. And the health sector knows how to respond to all of those barriers. You might not know how to respond to those individual barriers, but that doesn't matter. Now, where we have an enormous overlap is that almost invariably, the geographical areas with the greatest barriers to family planning are rural areas, which is likely to be among the important areas that you are working. If we take this up a level and actually think of it from a policy perspective, we've undertaken analysis of the national plans under CBD. And if you look at all of the countries that are priority family planning countries, the bulk of them state that population growth is relevant to biodiversity, but it's very rare for those biodiversity plans to then talk about family planning and what you could do about that. So I was asked to very briefly say, look, why would you all be interested in this? Well, if we can remove barriers to family planning, this is obviously good for women and girls. It would improve infant and maternal health. But it would also reduce poverty, which you're seeing in more and more of your funding applications and incorporating into so many of your projects. And also by lessening unintended pregnancies, as well as lessening pressures on communities and families, we're also going to be able to lessen pressure on local resources. So in short, when the sectors work together, we believe that the PHE approach can lead to greater outcomes for human and environmental health, for gender and biodiversity.
Great, thank you so much, David. That was very eloquently said. I am going to stop spotlighting you, or maybe
can't smile that long, so the spotlight.
And return back to our presentation. And next up, I would like to invite Megan to present the definition that our learning initiative came up with for the conservation sector. So Megan, I will give you remote control and go ahead.
Thank you. Hi, everyone. So the definition that the learning group worked on went through many iterations and is quite lengthy. So I'm just going to read it through to you, but a lot of thought was put into this and particular aspects such as partnerships, holistic approaches, justice, equity, and inclusion principles were shown to be included. So population health and environment is a multi-sectoral partnership approach to biodiversity conservation, human health, and sustainable livelihoods. Sorry, I'm waiting for the computer to think. PHE approaches are developed inclusively and equitably in response to local situations and the expressed needs of the people most closely linked to biodiversity conservation. PHE is intended to improve human health, particularly reproductive health, while empowering communities to achieve sustainable livelihoods, manage natural resources, conserve biodiversity, and maintain ecosystem services. By integrating actions across multiple sectors, PHE can reach more people linked to biodiversity outcomes, engage more men in reproductive health, and more women in livelihood and natural resource management. The pauses are great. I'm terribly sorry.
Yeah.
PHE can ultimately achieve greater and longer lasting conservation outcomes than would likely occur without integration. When barriers to family planning are removed and contraceptive needs are met, women and girls can exercise their reproductive rights, leading to healthier timing and spacing of pregnancies, improved health of women and their children, and more time and energy to engage in education, conservation, and livelihood activities. So these anticipated benefits of a PHE approach are further outlined in theories of change that this learning group worked on. So next up is Claire Ralton, who'll be walking you through these theories of change. Thanks.
Thanks, Megs. I'm also waiting for the computer. There we go. So just to bring you all up to speed, a theory of change diagram aims to describe how a strategy is expected to lead to project success and impact. It describes the causal relationships of how one result or outcome leads to another. So in some cases, we may show enabling conditions that are required for a strategy to be implemented, as well as possible complementary strategies that may be associated with the main approach. We've developed generic theories of change, and really importantly, we would like these to be tested and adapted based on real world experience. So this is something that hasn't happened yet, but we would definitely like to do that in the future. And then just for those of you who have not used theories of change in Marathi, this is just a little bit of a key describing the relevant features and the associated shapes and colors you might see in this theory of change. We've used blue text to depict enabling conditions, green text to depict complementary strategies that may not be the main focus, but are necessary supporting strategies. And then this red text will illuminate possible undesired pathways we would be hoping to avoid. So I'm going to be going through two generic theory of change models. Firstly, integrating human health and conservation action, which illustrates how an integrated health and conservation approach is likely to lead to greater and longer term impacts compared to separate single sector approaches. And then secondly, a much more specific theory of change is our integrating reproductive health and family planning into conservation action. This model depicts the value of specifically integrating reproductive health and family planning components into this integrated health and conservation approach. So I'm just going to walk through these models for you. The first one, integrating human health and conservation action, has some desired outcomes, which are displayed on the very right-hand side of the screen. These would be to achieve a reduction in the major threats to biodiversity, as well as at the same time an improvement in human health and related attributes of human well-being. So ideally, we are hoping, sorry, I don't know if that was me or somebody else, but anyway, don't worry about that. Let me just go, actually, I'm just going to leave it there for now. There we go. Okay. So I was talking about those ultimate outcomes. So basically, we are hoping for both conservation and health and well-being impacts. On the very left-hand side of the screen, we've got some enabling conditions that are in place. These are the boxes with blue text. So these enabling conditions are really important to be in place in order to for the strategy to be as relevant and effective as possible. There needs to be linkage between human and environmental health, obviously. Ideally, you would like government policy and funding to be in place. And you'd also really like there to be an expressed need by the community for the provision of these health services. And the fact that any influences from outside of the area of concern do not prevent the project outcomes from taking place. Then these first two group boxes include the establishment of this integrated partnership between health and conservation partners and any other relevant partners that may be involved in the project. This partnership allows for the delivery of integrated messages and services that hopefully reach a wider and more targeted audience than would be possible through just single sector approaches. The intermediate results that follow may lead to a number of different pathways. So these could be greater engagement in health, natural resource management, livelihood components, conservation actions, anything that may not be possible with a holistic, without a holistic sort of integrated approach. And then greater engagement is assumed to lead to a greater adoption and continuation of desired behaviors, leading to our ultimate outcomes. So you'll notice that those last two blue boxes, those last two results are connected by a dashed line, which just indicates that this is an important assumption for us to test in the future. Our next slightly more specific theory of change is around integrating reproductive health and family planning into conservation. Again, we've got our ultimate outcomes on the right-hand side there. These are obviously to reduce threats to biodiversity while at the same time ensuring that natural resources are sustainably managed, that biodiversity is conserved and ecosystem services are maintained. Simultaneously, we would like this approach to improve human health particularly reproductive health, and achieve more sustainable and resilient livelihoods for the local people involved. You've also got enabling conditions on the very left-hand side of the model. These are quite similar to those described in the previous theory of change, but really importantly, there should be an expressed need by the community for the delivery of reproductive health and family planning services, as well as access to sustainable livelihood opportunities and support or extension services. Again, really importantly, there we go. Really importantly, for this approach to be successful and effective, we need the establishment of these integrated partnerships between health and conservation partners. And this is obviously crucial. This partnership allows for the delivery of integrated messages and services that would reach a wider and hopefully more targeted audience than would be possible with a sort of single sector approach, as I mentioned. And then a critical stage or initial stage in this strategy is around removing barriers. So these may be barriers restricting access to health and family planning services, barriers to the equitable involvement in conservation initiatives between both men and women, barriers to natural resource management, barriers to sustainable livelihoods. So there are a number of barriers that would need to be identified and would need to be addressed. And along with this strategy, we have a number of supporting strategies, which are depicted by the yellow hexagons with green text. These might be things like education, outreach, and communication, gender equity and empowerment, and these will help to remove those barriers and improve knowledge and appreciation of the linkages between population growth, human health, and the environment. And then really importantly, the core of this theory of change is meeting the reproductive health and family planning needs of the people. This is expected to lead to couples, women, and girls choosing whether, when, and how many children to have. And this is expected to lead to the healthier timing and spacing of pregnancies, which improves family health. Families, especially women, would have more time and energy to engage in livelihood and natural resource management opportunities. And then integrating our supporting strategies would engage community members in sustainable livelihood opportunities, natural resource management strategies, such that the undesired result of investing more time and energy in unsustainable practices is not realized. So these boxes here with the red text is what we hope not to happen. These are undesired but possible pathways, and hopefully our supporting strategies would help combat those particular results from taking place. And there's also some uncertainty about whether healthier families and healthier timing and spacing of pregnancies will lead to the long-term decline in fertility rate. It is expected, but we've got a dotted line depicting these assumptions here. So additionally, a decline in the fertility rate may not necessarily result in the reduced demand for natural resources, but this is again an assumption we're making. So as a final note, it's important just to acknowledge that these integrated supporting strategies we have here in green text are necessary to achieve our desired outcomes, but may be dependent on the situation in that particular context. So it's definitely not limited to these 5 illustrated supporting strategies. More or less of those may be necessary depending on the various environmental contexts. Thanks so much.
Great, thank you, Claire. Now we'd like to hear from another voice from the PHE community, and I'd like to introduce Nagash Teklu from PHE Ethiopia Consortium.
Good evening. So the definition of PHE and the theory of change related, we have that practical experience in the context of Ethiopia. The PHE approach in Ethiopia that is contextualized to our environment. Ethiopia, as you know, is the second populous country in Africa. We are now around 115 million. Even Ethiopia is the hotspot of biodiversity. 3 or 4 hotspot areas are in Ethiopia, but be it on the population direction or on the biodiversity direction, we don't have a productive population. We have many vulnerable children. We have poverty that is pushing us to migrate to any direction. Even the biodiversity condition is declining from time to time and even affecting our agricultural productivity. So the poverty of Ethiopia is related to the erosion that is coming from deforested landscapes we have. So taking this into consideration, working conceptually and practically on how we harmonize the relationship of the population growth to our biodiversity ecosystem, to our economy, and how we can really satisfy the well-being of our community and our ecosystem was so crucial. So we initiated this PHE approach, not anywhere, but where the population pressure is impacting our protected areas, our forest area, our wetlands, our biosphere areas, and our upper catchment basin, where Ethiopia has more than 12 basins, source of the many rivers that goes internationally, like the Nile River and others. So bringing this conceptual integration of social, economic, environmental was crucial. So we initiated our approach, as I said, in those areas. If you go to our website, many of the projects we have, they are like in Gwassa, it is a community-based conservation work. In Bali ecoregion, where our forest and the Red Plus project is existing. In Southwest Ethiopia, in Central Rift Valleys, where many of our lakes exist. And in this area, we are bringing practical change, first of all, on the community who are living in those conservation sites. We are changing their attitude, their approach, their livelihood, not by addressing sectorally, but by addressing their multifaceted demands in a comprehensive, integrated way. This result is not only bringing results to the community, but also attracting government policy to check themselves how the multi-sectoral approach can be addressed in the many big projects the country has, like the watershed project, the sustainable land management, which they were not incorporating social issues in their approach as a package. Now they are incorporating to the livelihood packages, to the conservation, to the agriculture, social inclusion issues, because they have seen that it has better results. The same is true for social scientists who were dealing on population issues, on gender issues. Now they realize how integrating those issues into climate, into conservation, into agriculture has more meaning practically. Even donors are realizing this approach. And if you take from our background, the resources we were generating sometime before 10 years, 5 years is different now. The projects we had were project level. Now we are looking program level. We are looking at landscape ecoregion level, where we can impact the ecosystem in a better approach. And the partnership we are establishing, we are strongly partnering with conservation organizations like FZS, Frankfurt Zoological Society, which is one of the champion of protected areas, Farm Africa, champion of agriculture, IWMI, champion of water resources, SOS Sahel, champion of livelihood in conservation areas. So this approach is bringing real change on the well-being of communities and resilience of communities and resilience of our ecosystem, where we are trying to impact in a way we bring transformative change, touching the social, the bottleneck social norms in a way they are integrated to the conservation, to the agriculture, sustainability. So many of our projects are now from the perspective of integration because we are getting more acceptance and recognition. Thank you.
Thank you, Nagash. Your internet was a little spotty, but I think we still captured your main points. The work that you've done in Ethiopia is really inspiring, and it's a great example of PHE starting at a local level and being applied to scale across the nation. I will go back to sharing my screen, and I believe my next, yes, so let me check my time quickly. Great. So another objective of the Learning Initiative was not just to clarify what PHE is and its value, but also to understand the barriers to organizational adoption. What we found through our survey results to the wider CMP and conservation standards community was that PHE is relevant and could be very, very positive approach in many places where it's not being applied. So a number of the barriers that we identified included lack of funding, which also was raised as a huge barrier in the holistic learning initiative as well, the Holistic Approaches Learning Initiative. Lack of awareness of PHE and its value overall, a lack of organizational experience with integrated approaches, the increased complexity with those integrated projects, a lack of connection to appropriate partners for that integrated partnership work, a lack of policy support at all different levels, at local to national and beyond levels, a lack of evidence of impact, and a belief that PHE is a diversion away from a conservation mission-driven organization, and also some political and religious sensitivities, particularly around family planning. We also identified through those surveys factors that support adoption, including having a staff champion, having somebody on staff who champions the approach. I'm sorry, I have a very persistent cat that I have to knock off my table. Willing and able partners, dedicated funding, and that's not just dedicated funding for the implementation and for the integration, but it's also dedicated funding for the startup phase, for building trust with the communities, for following those justice, equity, diversity, and inclusion principles, and for taking that holistic approach, and for the long term, having funding that will sustain the long-term efforts. Also, if you have existing trust with the community and a strong experience with a participatory approach that helps mentoring from the PHE community and just a greater awareness of PHE across the sector, as well as case studies that demonstrate impact. So we put these in another theory of change, and I'm actually going to escape from here, and I'm going to show you what these theories of change look like in our conservation action and measures library. So I'm going to jump out of this presentation and jump over to our conservation action and measures our camel entry. So this is this particular theory of change that I'm going to show in our camel entry. I have up here on the screen, the diagram properties are open, and it basically shows you that associated with each of these theories of change is the narrative, which basically Claire read out that narrative for the other two theories of change. So let me move this and the cat. So this organizational adoption of PHE approaches theory of change is meant to illustrate the major factors that influence and may lead to organizational uptake of PHE approaches. The ultimate desired outcomes of this adoption are to have greater and more sustaining improvements to the status of the biodiversity targets, as well as human well-being, where PHE is being applied. So this PHE needs to be relevant to the organization, meaning the organization needs to have priority work in places where the health of the local people and the biodiversity health that they are interested in conserving are inextricably linked, where those biodiversity outcomes that they want to achieve cannot be achieved or cannot be sustained without improved local community health and well-being. But that's not enough to get an organization to adoption. There's a number of other factors that need to be in place, including internal factors and external factors. So internally, the organization needs to have the knowledge, will, and capacity to adopt PHE approaches. So they need to have the knowledge that PHE can have greater and longer lasting impacts, and they need the organizational support at all levels, as well as the staff that are dedicated with the skills and training and guidance to support that integrated partnership. Externally, they need the funding that I talked about, and they need the partners. If all of that is in place, then the organization, the next final intermediate results can take place where the organization actually starts to implement PHE in priority places. And then those PHE projects can start to yield results of impact. And if that happens, once there is evidence of impact, then that will lead to greater organizational internal will as well as external support, which will then allow the organization to roll out or apply this type of approach in additional projects and programs where it might be relevant, and ultimately to have greater and longer lasting outcomes. So that is a snapshot of what these theories of change look like in CAMEL. And you can see that the other two theories of change that Claire went over are also here in CAMEL. And this is kind of what the whole project looks like without zooming in on those theories of change. So I'm going to come back to the slide deck. And so I'm going to go right through this and hand it over to Megan, who is going to talk about the recommendations that came out of the Learning Initiative. Megan.
Thanks, Erica. Great. So the Learning Initiative highlighted a number of recommendations for future work, which obviously mirrors a lot of the barriers that we picked up. One of which was clarifying the connections between other approaches, this being, things like climate change, gender equity, as well as improving the documentation of PHE benefits. And going back to the theories of change, it would be to recommend applying case studies to these theories of change, but also continue to develop other key components and put them into theories of change for PHE projects. And as both experts mentioned earlier, another key component would be the dissemination of PHE resources across the conservation sector, as well as integrating these into existing key resources that we use in practices. And lastly, I guess this also speaks to what Harriet has just mentioned in the comments, but surrounding greater support within the donor community. So this initiative took place over only 4 months. And although we had many amazing experts in this field and we're thoroughly engaged in the learning, we are keenly aware that more work and more voices are needed. However, if you are keen to learn more, Sarah will actually pop the link for the final report, which also has a curated list of PHE resources and a number of case studies. And then if you are further keen to get involved with us, please drop your name in the chat or contact myself or Erica, and we can reach out to you and go from there. Thank you.
Great. Thank you, Megan. So yeah, if you are interested, don't just drop your name in the chat, drop your email address as well so we can contact you, or contact Megan and I directly. And next, we want to hear from one more of our members of a PHE community, and I'd like to turn it over to Tess McLeod from the Population Reference Bureau. Tess, you there?
Thank you. Yes, can you hear me?
Yeah, are you on video?
I am.
Okay. Oh, good. I'm going to spotlight you so we can all see you.
Can you find me okay, Erica?
Yes.
Okay. Wonderful. Thank you so much, Erica, and the team. So through this learning initiative, as you've heard today, those of us in the PHE community have worked to identify the key barriers and next steps for supporting conservation partners such as yourself in integrating human health and well-being in these multi-sectoral approaches such as PHE. And through the recommendations that you've heard that have come out of this report and this initiative, we're working to ensure that tools and resources are readily available to support integrated project design and implementation, including through the foundation of conservation and development partnerships, knowledge sharing, and more funding support key for integrated interventions. So at Population Reference Bureau, through our policy advocacy and communication enhanced for population and reproductive health, or the PACE project supported by USAID, we are also working on supporting this work, curating resources for the PHE community and interested partners, coordinating communities of practice, and providing technical assistance and support to forward increased multi-sectoral commitments. One thing that came out strongly in the learning initiative was that there are evidence and resources that exist, but they are not as widely shared, or folks are not as widely aware of them as we could be. So among other things, the PACE project is supporting integration of PHE and conservation through engaging high-level multi-sectoral and multilateral and bilateral donors and implementing partners, specifically in the conservation field, to raise awareness on PHE approach and its benefits, to try to secure more commitments, but also coordinating communities of practice so that those who are interested in this type of approach and implementing have access to the evidence bases, the resources, and knowledge sharing, so that they can start to design and implement this kind of multi-sectoral approach. We coordinate communities of practice through virtual engagements as well to discuss key topics and areas of interest for the community, and host a number of resources, including population health, environment, and development activity map that maps all of the different interventions, past and present, that integrate population health and environment across the globe. We are currently also working in partnership with other organizations on the Knowledge Success Project to launch a new knowledge management space that will bring together a lot of these resources and tools and make them available and more widely distributed across the community. This will launch on Earth Day, April 22nd of this year. And we're really excited to have a better, more streamlined repository of a lot of PHE resources, a calendar of events, and other engagement tools to help connect those who are interested in implementation with the resources that they need. So in the communication after this webinar, we will share a number of these key resources and tools with you as well, if you're interested to learn more. And thank you. I'll pass it back to Erica.
Thank you. Next, we had one more PHE expert voice to hear from, and I want to introduce Janet Edmund from Conservation International. Janet, You have lots of light coming in.
Yeah,
your
you
window
can't
right
really
now.
see me. Sorry, I'll try to correct it. You see me a little better now, hopefully.
Yes.
Sorry. Um, Erica and International Saving Cranes and everybody there, thank you so much for all this work that you've done as part of the CMP Learning Initiative. And we have so many, longtime friends and colleagues on this call. I don't know how much advocacy really needs to be done at this point, but I do think it's really critical to point out what you guys have done has really, I think, moved us forward as a PHE community, because I remember in the summer getting the emails from you guys and being like, who are these people? What are they doing? And I think it was really useful for you all and the methodology that you use to kind of move us through this process to show how relevant PHE is, and how like the whole field of conservation has changed so much, right? We've gone from protected areas, like Nagash was talking about, to landscapes, and as we've kind of transitioned, we've learned how critical the people are to the conservation solution. And so for me, I've been working in PHE for, what now, 17 years, and I'm really fundamentally convinced we have to work on the people side in order for community stewardship and healthy families, healthy forests, healthy communities. We really need all that stuff to make sure that our conservation outcomes are going to be sustainable. So this opportunity to engage with you all and to actually put PHE into the CMP library, I mean, that's amazing that we're able to do that. So and I feel like there's so much to be said about PHE, but just to kind of build on what David and Nagash said, is like, this is very much a community voiced, rights-based approach. It is in no way meant to be something that any conservation organization is imposing on anybody. Voluntary is always a very key word that is used, and any kind of PHE project has fundamental principles that are used in engagement and participation. So just to put that out there, and I'm sure we can have a very rich discussion. So I won't say much more except to say CI works with Africa Biodiversity Collaborative Group, and we have for the first time in the last couple of years had a population health environment task where we are going to be promoting PHE to USAID missions and USAID partners in Africa based on the high unmet need for family planning in sub-Saharan Africa. So we will continue this work and continue to work with partners, health partners, international development partners, et cetera, to promote the really good lessons. And hopefully that will also build on what you guys are doing. So thank you guys again for doing this and giving us new energy and new opportunities to promote this approach.
Great. Thank you so much. So the next part of the webinar is to really have an exchange and be able to answer some of your questions, or have you be able to provide some input. But before we do that, I just wanted to check in, because a lot of times people drop off the call at this point. I wanted to just get a little feedback from you all. So we're going to launch another quick poll. If you would just respond to that poll, it should be up there now. There are 4 questions. So if you don't see all 4 of them, use your mouse to scroll down to the 4 and go ahead and answer all of those. And as people are answering that, if you have specific questions to our PHE experts or to the facilitators, please drop them in the chat if you haven't already. And I think that's really close to everybody on. So why don't we go ahead and share those results? All right, so this is primarily just to help us, because we do have another session to understand how the webinar was received. These are being recorded, and they will be, at least one of the 2 sessions will be up on the conservation measures or the conservation standards YouTube channel for other people to watch. So if you want to share the recording with some of your colleagues, you will have that opportunity as well. So results are mostly helpful. There are some no's about the theories of change being helpful, but everything else was, and the improving knowledge, but mostly the things are helpful. It was great to hear from the PHE experts. So thank you, David, Nagash, and Tess. Really appreciate hearing your voices and wish we had time to have more of the Learning Initiative involved. So I'm going to stop talking and have Sarah help us field some questions or comments from you all. Sarah, if you are there, you are on mute.
Yep, I haven't seen any questions come in the chat yet. So if you have any questions, feel free to post them in the chat and I will read them out.
If you are interested in just hearing more from any of our PHE learning group, let us know, or have any comments. Not seeing any. I have a question for our PHE experts. I'm not quite sure who to field this to, but I was wondering about the relationship between population health and environment approach and One Health. Is there one of you that would like to field that?
I'm happy to say something, but I think Nagash actually does One Health as well. So I might put that to him, if that's fair.
Nagash, are you still on and can you hear us?
Let David continue.
Oh.
Okay.
Okay. Well, population health environment from the health perspective focuses very much on family planning and infant and maternal health, whereas One Health is looking more at communicable diseases, so zoonotic diseases, sorry. So you might mix that up with a WASH program or something that's going to lessen the chance of zoonosis. So that's the sort of the key difference. And
can you describe what WASH is as well and its relationship?
Oh, sorry, water, sanitation and health programs. So it might be, I mean, this is relevant to one of our projects where diarrhea can impact humans and chimpanzees. So WASH programs and improved sanitation can lessen the risk factors of something that impacts both species.
And in my understanding of PHE, of that type of approach, if those types of things are a concern in the local area, then you might have both a family planning and reproductive health component as well as a WASH component.
Yeah, I mean, I think that's all of this work is relevant here, isn't it? Is that you need to look at the situation and then respond according to what's happening in the area. I think that's fundamental to anyone that's working in PHE, is that it's not a one size fits all, just the way it wouldn't be with a conservation project, is that you wouldn't roll out exactly the same way of conserving cranes in different countries or different communities, and communities have different health issues, so they need to be considered as well.
Sarah, are there any questions that have come up now?
Yes, we've got two questions. Yes. Could you give some examples of PHE working?
Yes.
Go on, Nagash.
Yes, yes, PHE is working. Let me give you an example. In southwest Ethiopia, where Ethiopia's forest remnant exists, the biggest threat for the forest of that area is the population increase that we see by cutting the forest area. They are changing into agricultural area, and at the same time, it is increasing the deforestation the siltation, the erosion of that area, and minimizing the productivity of the agricultural area itself. But through the intervention of PHE approach, your work focuses how the community understanding and ownership of the ecosystem in the area. Their understanding on the ecosystem, you change it starting from their household, their backyard, how it becomes green, their farm area, how biologically they can prevent the erosion and increase the productivity of their farm area. It could be through terracing, through planting different grasses that prevent the erosion. Then their understanding of the watershed they live, connecting to their backyard house, to the farm area, the watershed, and the bigger picture, the landscape they are living. If it is a forest area, clear understand how their living is connected to the ecosystem, the landscape, the watershed, their farm, and their household. That way, you have connect to be real owners, and their understanding is changed. In that way, you improve their income, their livelihood, and if your activity, social issues like gender, full tradition, that family is liberated. Even the men who are working in the forest, like the PFMs, they have understanding of what social inclusion is, what social norms, bottlenecks, social norms are related to their economic living. In that way, practically working in Southwest. In Gimazon, in Ilibabor, we have pilot showcases that could be a learning to the other world.
Is there, thank you, Nagash. That's,
If I have.
you started to break up a little bit more, but we got a really good part of what you said. Is there anybody else who wants to come forward with a quick example?
Yes. No, not examples. It was a question, so sorry.
A question, okay. If you want to stick that in the chat just for a moment, I think we had one more question that was queued
we
up.
have a question about what was the experience of working on PHE and working with conservation colleagues? Most of the people here seem to be from the population health side. Was there any success breaking some of the silos between the population health and then environment partners?
Yeah, I was keen to jump in and answer this one because I thought that the answer to that is joyous. There is an assumption, I think, a lot of the time that conservation organisations are going to use the wrong language or they're doing it for the wrong reasons. But actually, we've just seen people from the Endangered Wildlife Trust set out the definition of PHE. We had someone else from the Endangered Wildlife Trust talk through the theory of change, talking about healthy timing and spacing of pregnancy and barriers to family planning and unmet need, and actually using all of the language which health advocates would have used. And so the Endangered Wildlife Trust and International Crane Foundation were, I suppose, the key organisations leading this, but they weren't the only ones on this programme. And my experience was that was reflected throughout the whole process, that everyone was very keen to, the conservationists were very keen to understand the right language and approach from the health sector. And it was very easy. That was a really positive aspect of this project for me.
May I add?
Sure, Nagash.
Yes, practically, we have practical partnership development we have in Ethiopia. You know, Frankfurt Zoological Society, who are responsible for wildlife, like in the Serengeti, and they are very active in our hotspot biodiversity areas, like in Bali ecoregion, in Semian Mountains. And at the beginning, they were conservation areas by sector, by conservation only. But they had resistance at the beginning. Once we work in partnership.
Nagash, your audio is cutting in and out.
Now, Frankfurt Zoological is what about
yeah, your
now?
audio is cutting in and out. I think maybe we can find another opportunity to have you share that example, maybe through the follow-up email. And maybe we can go on to the next question. I think there's a couple in the chat. Sarah and Jorge had also mentioned that he was interested in posing a question or a comment.
Yeah, so the next question was about the theory of change. Going from left to right and following the arrows, it doesn't seem logical in the sense of if A, then B. Could you clarify the logical flow?
I think I'll handle that. I think that might take us a little bit too long I think we'd have to pull up the theory of change. Ideally, a theory of change does read as causal relationships where if one result takes place, then that will enable another result to take place. We might need to actually get on a call with you and just see where in that theory of change that logic doesn't match up with your understanding, and see whether we can improve. Those theories of change, like the definition, are working definitions and working theories of change that can be improved and adapted over time. So it would be great if you have some ideas for improvement or clarification. So let's move on to another one.
Okay, the next one, is there any progress on how to use PHE approach as a tool for sustainable change for conservation at a global level?
I'm happy to say something on that. I think you did that. PHE projects are designed for a specific community, probably linked to a specific ecosystem or habitat or species. So the concept can be used widely, but adaptable everywhere. So from a global perspective, I wish there were global policies which highlighted that we should be thinking about this much more, and far more organizations recognizing that this was applicable in far more sites. But I don't think you'd have like one method rolled out globally. So I think it's a different way of looking at it.
Thank you, David. Do we have any other?
We do have more questions. So the next one, have you taken into account situations from developed countries with local populations, farmers, shepherds, etc.?
Any Tess or David? You have examples of PHE being applied in developed countries?
I can try to take this on, but I'd love for David or Nagash to jump in as well. I think as we're talking about the PHE approach, we're really, as David was mentioning, focused on communities in areas of high biodiversity and low resource settings where there are key needs that need to be met, especially needs around healthcare that are of vital importance to the community. So right now, this is something that is an approach that is dealing with the highest need areas in sort of these last mile communities. It's not something that is really being rolled out in other types of settings, but I think the concept of integration of seeing planetary health and human health as connected is definitely something that can and should be applied more widely, but PHE as implemented is really targeted at specific types of communities in these high biodiversity hotspot areas. And I'd love to hear if there are others who would like to add on to that.
I think all I'd add on to that, Tess, is that there are barriers to family planning in every country on Earth. So every country faces some barriers. Even in the United States, you have particular financial barriers to family planning, don't you, as well as legal barriers in some areas. So there's barriers everywhere, but that doesn't mean that the PHE approach is necessarily appropriate for every area. I would say that the PHE approach is underneath the bigger picture, which is barriers to family planning, a global problem. What do we do in different areas? Well, that's what we would do in everything that Tess just said of these low-income, last-mile communities where there's a big overlap of biodiversity threats and health issues.
In addition, sustainable development is not only for third world countries or developing countries. It includes to all. So PHE contributes to sustainable development, how addressing the social, economic, and environmental concerns. Those concerns are even in the developed world. The climate impacts are in the developed world. The economic crisis is in the developed world. Social problems are there. So as an approach, if we believe in sustainable development, it is contextualized, be it in the developed, in the developing. We should understand it that way.
We have a question about, is it possible to link the final report to on someone else's website is it public essentially? Can we share this publicly?
Yes, Janet, aren't you doing that?
Well, we've cited this in our ABCG reference sheet that we're going to use. But I think Sarah was asking about the, I'm going to say it wrong. It's not Knowledge for Health anymore. It's Success Project.
Yeah,
It's there, right?
Mm-hmm. Yeah. So my question was whether we could include it in that. It is a follow-up to Knowledge for Health, but it's Knowledge Success. So you were right, Janet, on both accounts. So we're a USAID funded project, and we work in the family planning arena, but we are working with PHE and global PHE partners to launch a site called People Planet Connection next month. And so we would love to include this information there.
That would be great.
I'm happy to email you separately, Erica, about it so that we can get the right links and everything.
Sarah, if you can just drop, if you haven't already, drop Megan and my email contact information into the chat.
Yep, I did.
Okay.
Yes. Yeah, she already sent it. Thank you.
All right, another question. How do you see the support of big donors like multilateral banks and mechanisms for PHE?
I will wait and see whether one of you PHE experts wants to weigh in.
Go on,
David, go ahead.
Okay, my answer was going to be that I don't. The really big organisations are also restricted. Like I get questions like this from my board a lot about what about the Bill and Melinda Gates Foundation? Well, it's so narrowly focused, and that's the bigger the donor, almost the more narrow the focus. To actually say like we're working with the International Crane Foundation, no big donor says that we're interested in finding a project somewhere in Uganda where there are issues of wetlands, cranes, and reproductive health. It just doesn't happen. So that I think that would be something that we need from this actually is to get through to the big donors.
May I add?
Please, Nagesh.
Hello?
Yes, go ahead.
Yes. Yes, the way we approach and we show our evidences and results really convince donors. From practicality, EU, they funded us before 6 years for 3.5 years. Once we showed them result, and mainly the result was on how the family planning, the population dynamics issue was handled in that forest area, Bali ecoregion area, where the fertility rate is higher than national, where polygamy, every kind of problems in relation to gender, to family planning, and where demand was not there. Once they saw the change, without competition, EU started to give us double of what we were getting before, almost 11 million euros for the project. The same is, for example, BMZ. Now they are supporting us on the community conservation. If you go to our project, the community conservation project, we call it in Guassa area, BMZ started to support us in that way and integrated for the coming 5 years. So it is how you show your evidences, how your approach is really bringing impacts, the partnership mechanism, the working modality you create, the democratic environment you create are that could convince. So your evidences are that could attract, but is it to the level of our expectation? No, still we need to work, we need still aggressively, and in that line, this discussion will be very helpful in generating evidences to convince those bigger donors.
Thank you, Nagash. What about another question, Sarah?
Yeah, we're having some great questions. So the next question is, what do you see as the advocacy needs or opportunities needed, and at what levels, to continue to support the expansion of PHE work? I know funding across silos continues to be a challenge in all areas, as we just heard.
I can answer, I just don't always want to go first.
Go ahead.
Well, I think we need advocacy at every level. One thing that we're often saying is that everyone's always talking about mainstreaming. They always mean mainstreaming their interest in other sectors, and we're not very good at mainstreaming other sector stuff in our own policies. So I suppose we're taking, I often talk about IUCN because we've just had a resolution passed at IUCN supported by several organisations represented on this, where the task force aim is to actually to do a lot of that, to work out what it is that conservation organisations might need to support them, partner with health organisations, to work out what might help governments change national policies to help them get behind this, and what might help donors and what might help with generating the data. So yeah, I think we need to do advocacy all over the place because it clearly hasn't worked over the last 20 years, or we wouldn't be here having this discussion.
May I add?
Yes.
PHE Ethiopia Consortium is attending in COP meetings, in the ICPD process, in the family planning international conferences, in the Women Deliver, but we are not as strong as we can convince. The PHE approach has more relevant for resilience, for climate adaptation, but no one is taking it seriously. So it needs strong advocacy. The same ICPD, zero maternal mortality, zero unmet need, zero GBV. It is better addressed through PHE with practical results, but it's not well taken. The same is on the family planning. The family planning, if really, we are every time talking to the same people. We need to come to the conservation sector, how the family planning acceptance can be accelerated. And it is through PHE that can happen. So our advocacy on global picture, we are weak. We were initiated a long time ago, but because of lack of strong evidences, and we are not strongly collaborating and coordinating our engagement, we are not showing the results. So advocacy work is really, really important. In a way, still we strengthen our evidences and facts.
I also saw in the chat, Judy and Cheryl, you were also maybe mentioning some potential ways to approach advocacy with donors.
Yeah, I think the community-led and community-voiced aspect that they're recognizing, and where planning is, and also budgets, you know, at that very foundational level, you know, whether it's district or community or whatever it is, that seeing that package of services, it is family planning, it can also be maternal and child health and WASH, and that package of health that is linked then to conservation is really critical. So it does go back to what David said about advocacy at all levels, right?
Mm-hmm.
You got to get the local, and then, you know, the provincial, and then up to the national, international. It's a lot of work to be done on all fronts, right? But lots of successes, like Nagash has pointed out, right? And others on the call who have a lot of great lessons learned that we can build on.
Also the way we frame it though, because I mean, all of the conservation organisations on this call would have been funded by the Darwin Initiative. But in our Darwin grant, it's the first time they funded family planning because of the way we framed that barriers to family planning were relevant to what Darwin funded. And they've told us they've never, you know, Darwin's been around since the Rio summit, but they've never funded a single family planning nurse before because they hadn't been presented the argument that made it relevant to what they wanted to fund before.
Sarah, any other comments or?
Yeah, maybe this is a good time for one last question, since we're right at almost at the end of the hour. But we talk about a lot about integrating the delivery of PHE strategies with communities, but how might we be talking about about integrating the receipt by community? Said differently, what are the ways we can make uptake easier?
I'd love to be able to answer that in July, because our project in Uganda, we've actually recruited some Ugandan ethnographic social scientists to spend 5 months with the communities to cover that, so they can actually then tell us what to do. But that I won't know till July, at least at that project site.
Anybody else on the call? Judy, Cheryl, looking for our sono from field work that you've seen on the ground? Putting you guys on the spot.
Hi, I'll just say that at the local level, we did a lot of work with champions. And so building those networks of champions is very critical. And, you know, again, as David was saying, it's not just your health champions, but, you know, in the champions group, you could really have a very multi-sectoral group of people coming from different sectors and thinking about how to budget these things together in a local government budget level. So those are practical discussions.
May I add?
So no.
So I think I saw one, that last question, I don't know if we should try to address on the flexibility from religious organizations.
Yes, I have a comment.
Okay.
The place I mentioned before, the Bali ecoregion, be it the Central Rift Valley project we have, the Southwest, those areas are hard to reach areas, and where religious leaders have upper hand. So to bring the demand of family planning issues without having religious leaders, community leaders, you cannot convince them. So we have now an approach, we call it Village Health Committee, PHE village committees. PHE village committees are where religious leaders, community leaders, champions, even including the political leaders, we bring them to a group, and we discuss with them thoroughly. Once they are convinced, they have their own toolkits that use convince every house. So a mother or a father, then they hear us, they hear their community leaders, religious leaders. That way, now we have a convinced religious leaders who convince the community for family planning. So that way, it is possible. The social norms, if you want to change them, you need to have champions within the society who have acceptance. It is that way we are bringing change on the gender issue, on the family planning issue, even on the conservation issue. For the conservation also, it demands the community leaders, the champions. Without them, you cannot have success.
Thank you, Nagesh. We are actually at the hour. I'm really surprised that we still have most of our participants on the call. So thank you all for hanging in there. Oscar posed one additional question, which maybe we can take on really quickly. The question is whether PHE is a task for conservation organizations and not for a partnership with people, organizations who have the know-how and experience in fields that are not of conservationist expertise. And I think that that was something that we tried to emphasize in the definition and the theories of change, that really conservation organizations shouldn't be taking on health. They should be partnering with health partners. So I think that there was a strong emphasis on the need for that multi-sectoral partnership for this type of approach to be effective. Is there any last minute comments before we jump off? I just wanted to say thank you so much to our experts who logged in, and thank you to all of you who came on and stayed with us. And please share the link to the recording with your colleagues, and reach out to us if you're interested in getting more involved. There'll be a follow-up email, and thank you all so much.
Thanks, everyone.